Student here at College of Nursing, and today I will be doing the trach suctioning portion, and I will be starting it from about step 7. So I will know I already have all my PPE on. I would normally have on a gown, all my PPE on, so I'm going to verify my patient, all that. I'm going to open my kit, remove my gloves, perform hand hygiene, and put on my sterile gloves. Now that I have my sterile gloves on, I'm going to remove my saline, open it, place it back in my box, and keeping my top sterile as well, place it back in there. Now I'm going to grab my catheter, curl it around my hand, making sure the tip of the catheter stays clean. I'm going to hook it to the suction on the wall. This hand's now contaminated. I'm going to insert it without contaminating my clean hand. Okay, so suction's in. I'm going to remove this. I'm going to test the suction, lubricate, and test the suctioning. And I'm going to hyperoxygenate my patient 5 to 6 breaths on 100% oxygen with an ambu bag. Or do that every 30 seconds. Okay, now I'm going to insert the suctioning, making sure I do not hit the outer cannula and contaminate, and then I will not do it with suction. I won't do suction while inserting. And I will try to insert it with inspiration. Alright, so I'll go all the way down till I hit resistance, and then I'll pull back a little bit and begin suctioning. I'm turning it while I suction. Okay, now I'm going to suction my tubing again, cleanse it, and hyperoxygenate again. I want to note that I would wait a full minute in between suctions, and also I would be monitoring my patient's O2 at all times, and I would notice a drop in their heart rate fluctuation between 20 beats up or down, that I would stop, and if their O2 went below 90 or 5% from their baseline, I would also stop. So I've already rinsed my saline, hyperoxygenated, so I'm going to, once again, without suctioning, insert the tubing, making sure not to contaminate, go till resistance is met. Pull back a little bit, and then suction. So I was suctioning intermediately while continuing to rotate. So now I'm going to rinse my saline, take my tubing off. I'm going to hyperoxygenate again. Now that I'm hyperoxygenated, I'm going to place my patient's O2 back on them, remove my gloves, perform hand hygiene, put on my clean gloves, and I'm going to auscultate breath sounds. So I would compare that respiratory assessment to the one previous before we started, and I would also encourage my patient to cough while I was suctioning. Okay, so now I'm going to lower my patient's bed, raise their side rail, hand them their call light, make sure that their bed stays above the 30 degrees. I'm going to remove my gloves, remove my goggles, remove my gown. I would remove my mask, but it's taped to my face to not fog up my glasses, perform hand hygiene, and then I'm going to go document. I'm going to document the characteristics of the secretions, a patient's response, and the respiratory assessment.